Hi, good afternoon. My name is John Brown. I'm Northampton County Executive. And I'm here this afternoon to talk to you about the changes upcoming in our healthcare plan for Northampton County. There have been a number of questions raised over the last few weeks. So I thought this would be the most direct way for you to find out specifically what's going on with our healthcare, the changes that are being made, and really why. What is the nature of the changes that we're making and the reasoning behind it. Just to give you a context, Northampton County has a robust benefit plan, and one of those key features is the medical plan that we're able to offer. As I've come into office and started looking at really what are the cost drivers to the county. You've heard some things about general funds and budgets and those kind of things. But as we wade into healthcare, if we step back from the county, we know there are a number of changes occurring in the general marketplace with the Affordable Care Act coming into being. How does that affect Northampton County as we look forward going from there? Specifically, the challenges that we have is that in 2009, the county spent approximately $17.5 million on healthcare for roughly 2,100 members, if you would, employees that signed up for the plan, about 4,600 total members overall. That number hasn't fundamentally changed. In 2014, we're expecting to spend $24.5 million. That's almost $7 million of increased consumption of health care. That's a very significant feature when we consider the fact that the number of employees and family members that are participating in the plan hasn't really changed. So that averages out to approximately $4,000 per employee in the consumption of health care. And that's something that we really needed to weigh in and take a look at. In considering what we should do, we looked at three options, if you would. We could leave the current plan alone and just carry forward as we are, with an anticipation in 2015 that our expenses were increased to almost a little over $26 million, if you would. The employees do contribute to our plan. So against that $26 million, we collect approximately $2.5 to $3 million from the employees through your contribution to that. So that's a net to the taxpayers, if you would, of almost $22 to $23 million. So that's really what we really need to take a look at here. The options we have are leave the plan alone. We could move to take advantage of the exchanges on a national basis, if you would, or modify the current plan. If we left the plan alone, one of the things that we really have to consider, along with the increased annual cost of healthcare, is the fact that in 2018 there's something called the Cadillac tax, which is essentially a tax, an excise tax from the federal government that the county would have to pay based on the value they assess of our healthcare. At the current consumption rate, which increased from 2012 to 2013 of almost 26%, we would be facing a penalty of $9.3 million. That's a check we would write directly to federal government, no benefit to the county, and no benefit to you, the employees. The second option would be to take advantage of the exchanges. What does that mean? Essentially, Northampton County would no longer offer its employees a direct medical plan like we do today. We'd ask the employees to go out on the exchanges, as others do, and buy your insurance that way. Why would we consider doing that? Many employers have actually considered going down this path. We would still pay a penalty. We would pay a penalty per employee of approximately $2,000. And that would translate to about a $4 million penalty we would pay to the federal government. But against a $24.5 million spend, the county would actually realize about a $20 million savings in going that path. The challenge is for a single person, for example, that go out there, premium now that you would pay would be almost $600 a month. If a family of four, that number increases to almost $2,000 a month for that kind of health care. So it's really not something that we're inclined to do, but it is a reality of the marketplace, if you would. The third option, and what I believe is the most conservative option, is to take our current plan and slightly modify it. And that's really what I wanted to focus on with you this afternoon. What are we going to do to modify the plan? And that's what I think you're most interested in. Essentially, we took a look at all the components and how we could begin to move our plan in a direction that allows us to continue to provide a very robust plan to you, allow us to bring the plan in alignment with the Affordable Care Act so that in the future, if that act still continues in 2018, we can avoid that $9 million penalty. And so essentially, what are the changes we're looking at? We are going to look to increase the deductibles for your plan. Currently a single is $250. We will be taking that up to $500. A family deductible of $500 would go up to $1,000. We're also taking up the out-of-network deductibles. Out-of-network is, we have a plan, if you go outside participants in that plan, there's a cost to that. So that's probably the biggest change that we're making. We're taking those deductibles up from $500 for a single to $5,000 for a single person. And for a family then, which is currently $1,000, we would take that up to $10,000. That seems egregious, but it's a very small portion of the plan itself. But it's something that we really need to do in order to contain that. We are also adding a copay, a co-insurance, if you would, of 10%. That's new to the plan, and that would be something that would affect your total out-of-pocket expenses for the year. The plan would be in alignment with the Affordable Care Act, which is approximately $6,600 per person, or $13,200 per family. Now that again seems like a lot. However, the plan is being designed really in a way that the current health care that you buy in the marketplace today, you can still acquire all of it the same way. We've structured the plan in such a way that you could buy, stay within your deductibles, and unless you really went outside the plan, that you should be able to not have to spend much more than you did last year on your health care overall. There are some other minor changes in the plan. So the biggest change probably would be in the pharmacy. We have what's called an open formulary right now, which any drug that you wanted to purchase, you could go out and buy today, whether you had a co-pay or co-insurance for it right now. We're limiting that, but limiting it doesn't mean you can't get what you currently consume today. All the brands that you consume today, all the active drugs are available in the formulary. We've already checked that with our provider going forward. We've increased some of the deductibles, if you would, for the per prescription price, if you would. We've moved them up slightly overall. So in the coming week or in the coming weeks, we will provide you a set of dates. We will have our third-party administrator, Capital Blue Cross, be available as of open enrollment, which is October 1st, and provide all the details that you need specifically for your plan and how that would affect you and your family going forward. So thank you for being a county employee. Thank you for what you do for the county, and looking forward to having further conversations with you down the road. Thank you.